May is Lyme Disease Awareness Month, and experts are urging precaution as tick season is ramping up now. So Maine has seen a record number of Lyme disease cases just over the past 2 years, and ticks carrying diseases are established now in every county except Aroostook.
Maine health researchers are also trying to determine why some patients experience symptoms months or even years after treatment. News Center Maine's Vivian Lee shows us more from Scarborough.
Most people recover from Lyme disease after a short course of antibiotics, especially when caught early. Some patients, though, continue to have symptoms for years. Scientists at the Maine Health Institute for Research want to understand why.
We want to capture enough people in the study who have those persistent symptoms after 6 months, because that might be 5 or 10% of the people who are treated for early Lyme disease, or maybe more.
Dr. Rob Smith leads the vector-borne disease lab at MHIR. He is in charge of Maine's part of a multi-year, $20.7 million study, which began last summer. They plan to enroll an additional 30 patients in the near future. The U.S. CDC says up to 20% of people with Lyme disease may have long-term symptoms such as rash, fatigue, joint pain, and muscle aches. Researchers hope this study will help find new treatments.
It may involve antibiotics, possibly, but we're also thinking that there's a high likelihood that it will involve other approaches to trying to deal with an immune system that's dysregulated.
Research assistant Jesse Tagree is working with vector ecologist Chuck Lobelchuk to track ticks that carry disease in every county in Maine. He says that even after a harsher winter and ongoing drought in some parts of the state, ticks are spreading to new areas.
Even in Somerset County, which we didn't have a few years ago, Washington County, which we did not have a few years ago, but they're now pretty firmly entrenched, and Aroostook is like the last holdout.
In a new study this summer, MHIR staff scientist Rebecca Robich and her team will compare Powassan virus strains from coastal and inland areas to help protect the public. 2 cases of the virus, which is carried by deer ticks, have been reported this year. Unlike Lyme disease, Powassan can be deadly and may cause long-term neurological problems.
We may be able to say these areas might be at a higher risk for people than other areas, depending on the strain and where the location.
Experts recommend protecting yourself with repellent, long-sleeve clothing, and tick checks. Anyone experiencing a rash or unexplained flu-like symptoms should seek medical attention right away. In Scarborough, Vivian Lee, News Center, Maine.
Patients need a referral from their primary care provider to join the study at sites in Biddeford, Portland, Brunswick, Rockport, or Belfast.